Hello friends. So let's begin with the MCQs. And the first one is during ocular motility, increase blood flow of intervention of okay, anyone there? Yeah, okay. During ocular motility, increase blood flow of innervation to the contacting muscle is accompanied. Okay, how many are there? 4. Yeah. Okay, I'll just repeat the question. It's during ocular motility, increased blood flow of innervation to the contacting muscle is accompanied by decreased flow of innervation to relaxing antagonist muscle. So the statement describes which law. Basically, they are talking about the law. So which law describes whatever I said? So options are Harring's law, Sarandon's law, Laplace law, it's a Hicks law. So I repeat, it's during ocular motility, increased flow of innervation to the contacting muscle is accompanied by a decreased flow of innervation to the relaxing antagonist muscle. So basically, what is the law? So options are Harring's law, Sarandon's law, Laplace law, it's a Hicks law. Anyone if you want to try? Laplace law, no, it's not Laplace law. Answer is B. It's Sarandon's law basically. So Sarandon's law is just like if it is an agonist, it will supply, and if it's an antagonist, it will be decreased flow. Basically, decreased flow for the antagonist muscle, and it's an increased flow for the agonist muscle. And Harring's law is basically it's equal innervation is there for Harring's law, and the answer is Sarandon's law. So Sarandon's law, it will be what I called it is contracting muscle will be it's not A, it's B. Sarandon's law, and what I told is Sarandon's law. It is basically for agonist muscle, it will be contracting muscle, it will be increased flow, and it will be for decreased flow for antagonist muscle. So next question we have, it's pathology, and OBG also. So 46-year-old woman comes to you with lower abdominal mass for the past 2 years. She has undergone uterine artery embolization for fibroids 5 years ago. Ultrasound shows a homogeneous mass near the uterine fundus. On explorative laparotomy, the mass was observed to be attached to the greater omentum, and it was H-size. So histopathology of the mass is shown below. What is the diagnosis? So I will just tell what is the pathological picture they have given. It's basically a uterus only. It's basically spindle-shaped smooth muscles they have given with blunted nuclei. So basically the options are pedunculated fibroid, parasitic fibroid, leiomyosarcoma, or it's a decimated intraperitoneal leiomyomatosis. So it's a big question. I will repeat once again. It's a 46-year-old woman, lower abdominal mass for the past 2 years, undergone uterine artery embolization for fibroids 5 years ago, and ultrasound is homogeneous mass near the uterine fundus. So you do a laparotomy and you find out it is attached to the greater omentum, and you excise it. And on excision you find the histological picture that is basically it's spindle cell, that is soft tissue only. Smooth muscles are there, spindle-shaped smooth muscles are there with blunted nuclei. So if anyone wants to answer this, it's a pedunculated fibroid, parasitic fibroid, leiomyosarcoma, or it's a disseminated intraperitoneal leiomyomatosis. Can't hear. Am I audible now? Hello? Okay, So options are pedunculated fibroid, parasitic fibroid, leiomyosarcoma, and disseminated intraperitoneal leiomyomatosis. So basically it's a leiomyosarcoma. It won't be there because it's not a sudden increase in mass. So basically carcinoma won't be there, and pedunculated or parasitic fibroid can be there. See, the answer here is B, that is the parasitic fibroid. Why? Because on laparoscopy or laparotomy you do, here you see it is attached to the greater omentum. So if it is attached to the outer side of the uterus, basically if it is not in the uterus and it is there in the extrauterine sites, it's a parasitic fibroid. And if it's a pedunculated, there might be some stalk will be there which it will be attached. And leiomyosarcoma, it won't be there. And leiomyomatosis is basically also it's a benign tumor. But for leiomyomatosis, it involves large areas of subperitoneal surfaces. So am I audible, or again I don't know, no one is responding. Okay, the answer here is parasitic fibroid because it is in the extrauterine site. So next one we have, which of the following is the best method for detecting and localization of tumors associated with pheochromocytomas? And the options are abdominal CT, fluorodopa PET scan, MIBG scintigraphy, or it's an abdominal MRI. Yeah, okay. I will repeat, which of the following is the best method for detecting and localization of tumors associated with pheochromocytoma? And the options are abdominal CT, fluorodopa PET scan, MIBG scintigraphy, or it's an abdominal MRI. Basically, investigation of choice for localization of tumor. Pheochromocytoma, you might be knowing, basically it's a cancer somewhere and you get the symptoms somewhere like that. It is definition they haven't given, but what I know it's like that only. The cancer will be somewhere else and the symptoms will be somewhere else in the other organs. So basically metastasis is the case. C MIBG scintigraphy. No, because I also not PET scan only. It's a B only because it's basically metastasis you have to see now. So you will see fluorodopa PET scan. So answer is B. MIBG scintigraphy they haven't given here anywhere. Yeah. And if MRI must be performed if there is a biochemical testing for pheochromocytoma is positive. But yeah, gold standard is PET scan. And MIBG scintigraphy is the least sensitive. Yeah. Okay. Next question we have, when treating a hypertensive patient with underlying coronary artery disease, what target blood pressure should you titrate for as per the ESC 2018 guidelines? And the options are 140 to 150, or 110 to 120, 130 to 140, or it's 120 to 130. Yeah, hello. So yeah, while treating a hypertensive patient with underlying coronary artery disease, what is the target blood pressure should you titrate for as per ESC 2018 guidelines? 140 to 150, 110 to 120, 130 to 140, or it's 120 to 130. Anyone wants to answer this according to ESC 2018 guidelines? You have to remember this question. It's okay, I will tell it's D. D is the right answer. The target blood pressure for a hypertensive with coronary artery disease is between 120 to 130. Basically, yeah. If it's the hypertension, it's 120 to 130. It's if it is a diabetes also, it's 120 to 130. And if it's a CKD, it's 130 to 140. And if it's a coronary artery disease, 120 to 130. We have to remember all the target values. C, no, it's a D. That is 120 to 180 is the target in BP in the underlying coronary artery disease as per the ESC 2018 guidelines. Okay, next we have while testing the taste sensation in a stroke patient, you place a few drops of sugar water over the circumvallate papillae. So which of the following nerves will carry the taste pathway here? And the options are chorda tympani, greater petrosal nerve, internal laryngeal nerve, or it's a glossopharyngeal nerve. So yeah, basically you have to know, you're testing for a taste sensation and you have to know which nerve innervates the circumvallate papillae. And the options are chorda tympani, greater petrosal nerve, internal laryngeal nerve, or glossopharyngeal nerve. At least you can try someone which nerve will innervate the circumvallate papillae. See, chorda and glossopharyngeal, I don't think. But yeah, answer is wrong. Okay, anyone? Okay, the answer is D here. Glossopharyngeal nerve is the taste pathway for circumvallate papillae of the tongue. It goes to glossopharyngeal. And yeah, we know this anterior 2/3 is by taste sensation from the anterior 2/3 of the tongue except the circumvallate papillae is carried by chorda tympani. So yeah, anterior 2/3 is by chorda tympani and other is by glossopharyngeal nerve. So this is an anatomical question, how to remember. So anterior 2/3 by chorda tympani and others will be by glossopharyngeal nerve. Yeah, right. Next we have a 4-month-old boy was brought to the emergency room with recurrent seizures. His mother informs you that he is receiving isoniazid prophylaxis as he was diagnosed as TB during pregnancy. So EBG revealed a high anion gap metabolic acidosis. What should be the mainstay of this treatment? So yeah, I will repeat, it's a 4-month-old and he was brought to the emergency room with recurrent seizures and his mother informs you that he was taking isoniazid prophylaxis followed TB. Let me tell the options first. Yeah, you want TB and ABG revealed its gap metabolic acidosis. What will be the mainstay of the treatment? And the options were benzodiazepine, barbiturate, pyridoxine, and thiamine. And yeah, you are right. It's that only. It's pyridoxine is the right answer. C is the right answer because for isoniazid overdose, basically it's intravenous mainstay is pyridoxine. So yeah, prolonged treatment with isoniazid leads to deficiency of pyridoxine, which can lead to peripheral neuropathy and other neurological manifestations like ataxia, paresthesia, and numbness. So yeah, you have to give intravenous pyridoxine because its deficiency occurs in isoniazid overdose. So yeah. Next we have the most common sinus involved in adenocarcinoma in workers of the furniture industry is, and the options are maxillary sinus, frontal sinus, ethmoid sinus, or sphenoid sinus. Anyone? Most common sinus involved in adenocarcinoma in workers of furniture industry: maxillary, frontal, ethmoid, or sphenoid. Yeah, I got this right. Anyone? Most common for adenocarcinoma in workers of the furniture industry is B. No. Frontal sinus, no. It's a C. It's a ethmoidal sinus, and the upper nasal cavity is the right answer. So yeah, it's have to remember this. There is no choice for that. Yeah, next we have woman. A 52-year-old woman presents to you with pain in the right wrist following a fall on an outstretched hand. On examination, tenderness was noted in an anatomical snuff box. A radiograph of her wrist is given below. What is the most likely diagnosis? And the options are scapulohumeral dislocation, mid-carpal dislocation, radiocarpal dislocation, and triquetral dislocation. I will repeat. It's a 52-year-old woman presents with pain on the right wrist following a fall on an outstretched hand. On examination, tenderness was noted in the anatomical snuff box. Radiograph of her wrist is given below. So, what is the most likely diagnosis? Yeah, we tell what is the radiograph. Yeah, the radiograph is basically it's a large gap is there between the scaphoid and lunate. So, the answer only that only is the answer. So, your options are scapholunate dissociation, mid-carpal dislocation, radiocarpal dislocation, and triquetral dislocation. So yeah, it's common. If there is a gap between the scaphoid and lunate, it will be scapholunate dissociation. And it's also known as tooth gap sign or Terry Thompson sign. So yeah. So we are here to learn only. So if it's wrong, also we can learn. So galat ho raha to it happens. So yeah, next we have a 26-year-old bride to be presented with nausea, vomiting, and recurrent episodes of postprandial epigastric pain. She has lost nearly 25 kg in the last 6 months to look good in her wedding dress, and proton pump inhibitors were tried but were unsuccessful. Barium meal follow through of the patient is given below. Which of the following is false about her condition? So basically you have to know diagnose, otherwise you won't. And as I will tell what is in the barium meal. Barium meal is where it is. I was not able to get. It's a irregular such dilatation of duodenum is seen in the barium meal. I will repeat the question again. The question is 26-year-old bride is there who is present. Leave the bride. It's a 26-year-old, nausea, vomiting, recurrent episodes of postprandial epigastric pain. She has lost nearly 25 kg in the last 6 months to look good in her wedding dress. Proton pump inhibitors were tried but were unsuccessful. A barium meal was there, and it's all dilatation of duodenum and dilator. Basically, which of the following is false about her condition? And the options are: weight gain is a part of the management, lying in prone position postprandially improves symptoms, surgical management is by duodenal gynostomy, or it's the second part of duodenum is usually involved. So yeah, usually I also don't know this. It's a SMA syndrome. SMA is Wilkes syndrome. It's seen usually in young asthenic women. It is a rare condition characterized by compression of the third portion of the duodenum by the SMA against its retroperitoneal structure. So yeah, and the answer is D, that is the second part of duodenum is usually involved in SMA syndrome, or it's also called as Wilkes syndrome. So you have to remember this. It's dilatation of the duodenum, rapid weight loss with an abrupt cutoff at this third part coinciding with the line of the superior mesenteric artery, suggestive of superior mesenteric artery syndrome. So yeah, I also didn't know the answer, yeah, but it's, you have to remember. So yeah, it's a SMA syndrome. Next we have a free hepatic venous pressure and wedge hepatic venous pressure of a patient with suspected portal hypertension are measured. How will the hepatic venous pressure gradient be determined from these values? And the options are HVPG is equal to WH, because it's a formula. If you don't know, okay, I will just tell what is FH VP is free hepatic venous pressure, and WHVP is wedge hepatic venous pressure, and HVPG is hepatic venous pressure gradient. So you have to know the formula. Without formula you won't be able to. I just tell the formula because I don't think anyone will be knowing. If you know, it's better. It's HVPG is equals to WHVPG minus FHVP. So yeah, it's hepatic venous pressure gradient is equal to wedge hepatic venous pressure minus free hepatic venous pressure. So here is the formula you have to remember. It's the most accurate method for determining portal hypertension by HVPG. Artificially determine the portal hypertension. Next we have, I think something interesting will come. Yeah, in your community medicine practicals, it's not interesting. You are given an apparatus as shown in the image below. Which of the following statement regarding the apparatus is true? Again, they are given the apparatus diagram. They have given, yeah, apparatus, I know this. So basically they are given different apparatus. It's for well, just the answer, no, basically it's a Horrocks apparatus. You all will be knowing this. Horrocks apparatus is for chlorine. How much quantity of chlorine is there in the well or water you have? So yeah, the question is, they are given a Horrocks apparatus, and which of the following statement regarding the apparatus is true? Options are: the indicator used is bromocresol purple, the indicator used is starch iodine, and then it is used to estimate free chlorine levels, and the last one is it is used to estimate combined chlorine levels. So yeah, it's a Horrocks apparatus. If you know which of the following is true, the indicator used is bromocresol purple, or it's starch iodine, or it is used to estimate free chlorine levels, and the last one it is used to estimate combined chlorine levels. Anyone wants to try this? It's white cups are there, yeah, one black cup and all that. Yeah. Well, the answer here is B, that is the indicator. What we use in Horrocks apparatus is starch iodine. It's not bromocresol purple. We use starch iodine. And yeah, that's all. It's not used for estimating free chlorine. No, it's not free or it is not combined. It's basically, it is not useful for measuring free and combined. It estimates the chlorine demand of the water and is used to calculate the amount of bleaching powder used to disinfect the well. What I told before, that disinfect the well, we use the bleaching powder in that case. So yeah, next question we have, the hyperkinetic feature of Huntington's disease is due to the loss of what? Options are nitrostriatal dopaminergic system, intrastriatal cholinergic pathway, and glutamate and cholinergic system, and the last one is intrastriatal GABAergic and cholinergic system. So I repeat, the hyperkinetic feature of Huntington's disease is due to the following: due to the loss of what? And the options are nitrostriatal dopaminergic system, intrastriatal cholinergic pathway, glutamate and cholinergic system, and the last one is intrastriatal GABAergic and cholinergic system. Yeah, if you can try this. Hyperkinetic feature of Huntington's disease. Anyone? Okay, yeah, the answer is D, that is, it's a loss of what? It's a loss of intrastriatal GABAergic and cholinergic system. You get hyperkinetic feature in Huntington's disease. And yeah, Huntington's disease, you know, it's autosomal dominant trinucleotide repeat disorder, and that all is not required, with multiple CAG repeats, and it's a chromosome number 4, which is the defective gene here. The next we have a diabetic patient who is diagnosed with hypertension during his annual health checkup. So what is the treatment of choice for him? Yeah, it's an interesting one. Diabetes is just with hypertension. So what is the treatment of choice? chlorthalidone, carvedilol, or captopril, or nifedipine. At this item you can just guess if you don't know. A diabetic patient with hypertension, what will you give? Invest drug of choice for this: chlorthalidone, carvedilol, or captopril, or nifedipine. Yeah, anyone? Anyone would like to guess at least? It's a hypertensive patient with diabetes. So what will be the drug of choice? Chlorthalidone, carvedilol, captopril, or nifedipine? Okay, the answer I will only tell it's captopril is the right answer because it's a ACE inhibitor, and ACE or ARB both can be considered as a drug of choice for diabetes with hypertension. So yeah, so captopril is the right answer. Because of renoprotective action, it benefits diabetic patients by reducing the risk of occurrence and progression of diabetic nephropathy. So yeah, if you give a diuretic, it will worsen glycemic control. If you give a beta blocker, it will worsen again glycemic control. And again, CCB have a neutral effect on glycemic control and can be used in diabetes. AC or D is not the right answer. C is the right answer. Captopril is the right answer. Your D is CCB, but CCB you can use, but the best answer is ARB or AC. CCB is it's a neutral effect on glycemic control, whereas beta blockers or thiazide will be worsening the glycemic control of the patient. So yeah, ARB or ACV inhibitor, if it's allergy or something like that, you can give CCB at this. Nifedipine you can give if it is like that. Next, we have a 23-year-old male patient who has lymph nodes involvement in the cervical and axillary regions without symptoms and is diagnosed to have Hodgkin's lymphoma. The senior resident clarifies that tumor has stage 2A. What is the name of staging system used? Basically, it's a Hodgkin's lymphoma and it has been staged as 2A. So, what is the name of the staging? It's a TNM, Masagoka, Diarrhea Salmon, or Ann Arbor. So, I repeat, it's a TNM, Masagoka, Diarrhea Salmon, or Ann Arbor system. So, in which Hodgkin's lymphoma we use like 2A. Anyone? See, I will tell Masagoka, what they have given is for thymoma, and modified Diarrhea Salmon is for multiple myeloma. So yeah, the correct answer here is D, that is Ann Arbor. So Ann Arbor is basically used for both Hodgkin's and non-Hodgkin's lymphoma. And TNM is not like 2A. So yeah, Masagoka is for thymoma and Diarrhea Salmon is for multiple myeloma. Next we have, this I think you can answer. Which is the most common benign cause of pyometra? Options are endometrial hyperplasia, senile endometritis, and then PID, pelvic inflammatory disease, or cervical stenosis. Yeah, it is try. It is which is the most common benign cause of pyometra. Pyometra is usually pus in the uterus, I think. And the options are endometrial hyperplasia, senile endometritis, pelvic inflammatory disease, or cervical stenosis. Anyone can try? Yeah, I told pyometra is that only. It's pus in the uterus. So yeah, I will only tell it's most common is senile endometritis is the most common cause for pyometra. Benign cause of pyometra. And yeah, the most common cancer that causes pyometra is carcinoma cervix followed by carcinoma endometrium. But yeah, we are asking for benign, so benign is senile endometritis is the right answer. Next we have a 4-year-old boy there who was brought by his mother with new onset nocturnal bedwetting. So she also reported he has been drinking more water for at least last 3 to 4 months, and viewed it at 24-hour urine volume which was 4 liters, and the urine osmolality is low. ADH is recorded to be 0.7 pg per ml, and T1 weight MRI brain indicated an absence of pituitary bright spot. What is the treatment of choice? Basically, you have to tell what a diagnosis, then only you can tell the treatment. So yeah, I will repeat. It's a 4-year-old boy. It's a 4-year-old boy, and new onset nocturnal bedwetting is there, and he has been drinking more water since last 3 to 4 months, and 24-hour volume is 4 liters, and his urine osmolarity is low, and ADH was 0.7, and you do MRI, you see a pituitary bright spot. What is treatment of choice? So first of all, what is the diagnosis, if you can understand what I told? Okay, I'll tell the options here. The treatment of choice is leupolide, thiazide diuretics, desmopressin, or terlipressin. Anyone? Just tell what is the diagnosis of whatever I told. Yeah. Okay, the answer is C, desmopressin, but the diagnosis is basically diabetes insipidus is there. To central, central diabetes insipidus is there. And for insipidus, the treatment of choice or the drug of choice is desmopressin. That it's a vasopressin analog. So and see, I will tell all that. Leuprolide was the option. Leuprolide is basically GnRH, and it's used in prostate, breast, and endometriosis. And thiazide we don't use here because it is used in nephrogenic diabetes insipidus. But here we are talking about central diabetes insipidus. So central diabetes insipidus we use desmopressin, and in nephrogenic we use thiazide. And and terlipressin is a long-acting analog or vasopressin that's it's not required. So next question we have, while camping in a forest, your friend is bitten by a snake. You have to provide first aid. Which of the following measures is not contraindicated in the case of a snake bite? Basically, it's a snake bite, and what is not contraindicated in this case? Options are suction and incision, electric shock treatment of the bite site, application of tourniquet, and the last one is application of constriction band. So which is the not contraindicated in case of snake bite? So suction and incision, electric shock treatment of the bite site, application of tourniquet, and application of constriction band. Anyone? I got the right answer. Anyone? Okay, the answer is D only, application of constriction band, because constricting band is useful. Tourniquet we won't give, that you might be knowing. Tourniquet we don't give, and suction and incision we never do, and electric shock treatment we haven't heard only. So the answer is constriction of the band may be useful. Next we have a 56-year-old dairy farmer presented with remittent fever and night sweats for 1 month. So basically it's a case of fever and night sweats for 1 month. Examination is hypotensive and pallor was present. And Rose Bengal card tests done on milk samples from his farm were found to be positive. And which blood culture method with biphasic medium will be used to isolate the organism? Basically it's a I'll just tell the options in the options are the battered method, Castaneda method, septic check method, and it's outside signal method. So basically it's a dairy I will tell this. Okay, it's a 56-year-old, remittent fever, night sweats for 1 month, examination hypotensive, pallor, and you have to know what is Rose Bengal test. Rose Bengal test was done on milk sample from his farm and it was found positive. So what is the biphasic medium we will use to isolate the organism? Batted, Castaneda, septic check, or outside signal method? Anyone? Basically, what is the diagnosis? The diagnosis here is brucellosis because it's a dairy. So if it's a case scenario of remittent fever with anemia with a positive Rose Bengal test, so the diagnosis is brucellosis, and you all know Castaneda method is for blood culture to isolate Brucella species. So my answer was wrong, but it's a silly mistake they have given. Sorry. So it's a case of brucellosis, and Castaneda method is the right answer to isolate the organism. So next question we have, which chromosome is affected in alpha thalassemia? Castaneda, Castaneda was the right answer. So which chromosome is affected in alpha thalassemia? Options are 16, 11, 6 and 12. If you don't know the answer, just guess it. Which chromosome is affected in the alpha thalassemia? 16, 11, 6 and 12, or 12. Anyone? Just try if you can. Okay, the answer is 16. 16 chromosome is affected in alpha thalassemia, and alpha thalassemia, you know basically what it is. It is decreased synthesis of alpha chains in alpha thalassemia. So if it's if it's a beta thalassemia, it will be chromosome 11, and here they have given it's alpha thalassemia, so it is 16. You have to remember this. So alpha thalassemia is 16 chromosome will be affected. So if the next we have, if the percentage of thymine residues in DNA is 28%, 16. So next question we have, if the percentage of thymine residues in DNA is 28%, what is the percentage of cytosine? This is this question is like we did for NEET UG. I'll tell the answer. I will tell the options: 28%, 44%, 36%, 22%. Basically, what is the thymine residues of? If the thymine residue is 28%, what is the cytosine residue? Anyone? we didn't need UG. It was a neat UG question like this, that A is equal to T, G is equal to C. So yeah, if A is equal to T, there is the cytosine. Okay, so if its thiamine is 28, so if it is A is equal to T, that is 28 will be thiamine, A is also 28. So remaining what it is left is, that is 28 plus 28 56. So remaining is 44%. So yeah, G is equal to C. If G is equal to C, then it will be divided by 2, that is 22 is the right answer. So think out just remember in this thing, A is equal to T, G is equal to C of DNA. I don't know if they will ask, but if they ask, it is good only for us. So yeah. Next question, a man is there who comes to a dermatology OPD with the following lesion. Further probing reveals a history of TB in his wife. Which of the following statement is false about the skin lesion? So I'll just tell what is there in the image. They have given an image. Basically, there is a plaques are there. Atrophic warty plaques are there. So basically, yeah, it's a dermatology question, and a man comes with the following lesion, and there is a history of TB in his wife, not him. So which of the following statement is false about the skin lesion? So you have to know the diagnosis for this also, otherwise you won't be able to tell. Okay, the options are: it is a multibacillary lesion. Second is it occurs in previously sensitized patients. Third is lesion healed with central scarring, and the fourth is it is the most common cutaneous manifestation in India. So if you can tell the diagnosis, basically it's a lupus vulgaris. Yeah. They are telling a scenario with a history of exposure to TB suggestive of lupus vulgaris, which often presents with what they have given in the image, that is atrophic warty plaques are there, and it's a possibacillary lesion. It's not, the option is, and the question was which is the false. So the right answer is it is a multibacillary. No, it's a possibacillary lesion. So yeah, the answer is A, that is overall right answer. Right one is it is a possibacillary lesion. So yeah, it occurs in previously sensitized hosts with good immunity. Most common cutaneous TB in India. In India, yeah, it's a plaque. So yeah, next question we will go through. Yeah, while performing an EEG on a sleeping patient, you observe patterns on the graph. The stage with maximum duration will be identified by the presence of which of the following waves? Yeah, you can tell this. Options are theta waves, sleep spindles, delta waves, or beta waves. So I repeat once again, you are performing an EEG, you are in a psychiatric OPD and you are performing an EEG. And on a sleeping patient, you are performing an EEG and you observe the patterns on the graph. So the stage with maximum duration will be identified by the presence of which of the following waves? And the options are theta waves, sleep spindles, delta waves, or beta waves. Anyone? You can guess if you don't know the answer. Okay. The answer is B, that is the sleep spindles will be having the maximum duration in EEG. Yeah, it's N2 stage of REM, that is the longest sleep phase, and it presents with sleep spindles and K complex. So I have to remember the longest phase is N2, that is the stage 2 is the longest phase, and that is it has sleep spindles and K complex. So I got to remember that. And we all know this stage of sleep, you know, it is NREM and REM, and NREM is the 75%, whereas the remaining, that is REM, will be 25%. Yeah, and NREM is divided into N1, N2, N3, and N2, what I told, is the longest stage. So to remember this. So next we have what does the blood gas partition coefficient of an inhaled anesthetic indicate? And the options are duration of action, potency, solubility in the blood, it's a solubility in the lipid. So I repeat, what does the blood gas partition coefficient of an inhaled anesthetic indicate? Duration of action, potency, solubility in blood, or solubility in lipid? So yeah, you can try this. It's an MCQs question. Okay, anyone want to tell this? Okay, I'll repeat for last time. It's there is a what does the blood gas partition coefficient of an inhaled anesthetic indicate? And the options are duration of action, potency, solubility in blood, and it's the solubility in lipid. So yeah, I think no one knows the answer. The answer here is C, that is the solubility of the lipid is the right answer. Basically, it's an MCQs question, and I have to remember this: the blood gas partition coefficient of the inhaled anesthetic. So yeah, if it's a decrease in BG coefficient, it will increase in the onset and recovery. So yeah, I have to remember there is no choice for this. So yeah, next we have following admission of basically it's a RTA case. There is a spillage of blood on the hospital floor. Which disinfectant will you use to clean the floor? It's an easy one. Options are ethyl alcohol, chlorhexidine, sodium hypochlorite, and formaldehyde. This usually we have seen in our casualty many times. It's a RTA case, spillage of blood in the hospital floor. Which disinfectant will you use? I think you know. If you don't know, guess it out. Options are ethyl alcohol, chlorhexidine, sodium hypochlorite, and formaldehyde. I got the right answer. Yeah, anyone? A, B, C, D. It's like KBC went to the ending. Okay, I will only tell it's a C. Its answer is sodium hypochlorite is the right answer. Because we use for in casualty, we have seen this. Yeah, this is by 0.5% sodium hypochlorite is the right answer. Next we have is the last question for today. What is the preferred management in an adult with Gadgeology fracture dislocation? And the options are close reduction with the above elbow cast, close reduction with below elbow cast, or it's an external fixation with Gadgeology method, or it's an internal fixation with compression plating. Anyone? Basically, what is the treatment of choice for a Gadgeology fracture dislocation in an adult? I will repeat options. It is close reduction with above elbow cast, close reduction with below elbow cast, or it's an external fixation with Gadgeology method, or the last one is internal fixation with compression plating. So yeah, last question at least. I think in the last 10 questions no one has answered. Yeah, anyone? Okay, I'll only tell it's D is the right answer. That is internal fixation with compression plating is the right answer for Gadgeology fracture dislocation. Yeah, A. No. It's A is what? Close reduction with above elbow cast. No, for Gadgeology we don't do that. Its option is internal fixation with compression plating. And if you want what is written here, it's yeah. It is managed by internal fixation with compression plating of the radius. And whereas in children it is close reduction is usually successful in children. So yeah. So you have to remember this also. It's internal fixation with compression plating in Gadgeology fracture dislocation of the radius. It will be. So yeah, for today it's over. Thank you so much for joining. Take care. Bye.